thing that I use in my practice the PerioLase for primarily, it's a palliative therapeutic tool for patients who have TMJ pain, particularly if I think it's inflammatory in nature. One of the things that's great about the PerioLase being a pulsed Nd:YAG laser, having a little bit more power than some of the low-level light therapy units that are out there on the market that are commonly used by chiropractors and physical therapists in their practices, is this PerioLase is a deeper penetrating light. It's a deeper penetrating energy. It's absorbed in tissues that tend to be darkly pigmented, and it's absorbed very effectively whenever there's inflammation. So if we've got inflammation in a jaw joint, inflammation in a muscle, the patients will feel it, as opposed to low-level light therapy that you shine the light, the little red dots on the patient, they don't really feel very much, and maybe it has an effect, but it's hard to tell if that's actually a therapeutic effect or if it's a placebo. So the relief that people feel with the PerioLase being used in this type of therapeutic model tends to be immediate, and it tends to be, for most people, pretty significant, where was a couple of weeks ago that I saw a patient who had had pain for years. And one treatment, one visit, and it was pain that I believed at the time originated in muscle tissue, masseter muscle. So we just treated that, leaned her back, treated that, took about 5-7 minutes with the PerioLase, and it's a very gentle, actually, it feels very soothing and warm. I tell patients it feels like a warm ray of sunshine, which is nice in Buffalo in the winter. But as she's feeling that, she's noticing a difference the whole time that I'm administering the light to the muscle. And when she sits up, she says, that hasn't felt that good in years. And that type of therapeutic result is pretty common with this laser. It's the reason that when we triage what we're going to do, what type of therapeutic modality we're going to recommend for a patient, the laser biostim with the PerioLase is at the top of that list at this point, because it's taken the place of things like trigger point injections, or I used to do a lot of iontophoresis, which is using an electrical stimulus on top of the joint with some lidocaine, epinephrine, and a steroid. And the electrical charge drives those medications through the skin and into the joint structures. With the PerioLase, we don't need to have anything on the skin stimulating in order to drive something substantive through the skin. With the PerioLase, we're dealing with light. So the light gets through there without causing any kind of trauma or any kind of disturbance at the level of the skin. It's not absorbed very much in the skin, which is one of the benefits of it.